Mythbusters. Do smartphones interfere with pacemakers and ICDs? The concern that smartphones, a ubiquitous feature of modern life, can interfere with pacemakers and ICDs is not new. It dates back to the era of mobile telephony, when phones emitted higher radio frequency power and lacked the sophisticated shielding and signal modulation of today's devices. In fact, a multi-center prospective crossover study of 980 patients, published in 1997, found an overall 20% incidence of interference, with a high degree of variability between manufacturers, 6.6% of which were classified as clinically significant. The effects included oversensing, pacing inhibition, and rare mode switching, particularly when analog or first-generation GSM phones in active transmission mode were placed directly over the device. Since the 1990s, there has been substantial evolution in both mobile and pacemaker technology. Contemporary smartphones utilize low-power adaptive transmission bursts, governed by strict regulatory standards, which substantially reduce sustained radio frequency exposure. Modern pacing systems and ICDs also incorporate enhanced shielding and advanced sensing algorithms, which minimize susceptibility to external interference. Subsequent studies have consistently demonstrated a reduction in clinically relevant interactions with newer generation devices. Even in controlled laboratory conditions, where phones are placed directly over the device, relevant effects are exceedingly uncommon, largely non-reproducible, and almost always transient, with negligible hemodynamic consequence. However, a newer consideration has emerged with the proliferation of embedded magnets in smartphones and accessories. A study in 2021 demonstrated that the magnets in a modern smartphone could result in clinically identifiable interference both in vivo and ex vivo by activating reed switches or Hall effect sensors, transiently placing the device into magnet mode, thereby suspending tachyarrhythmia detection in ICDs or altering pacing behavior. The US Food and Drug Agency carried out a series of tests to determine the safe separation distance between consumer electronic devices and implantable pacemakers and ICDs, where magnet mode could be triggered. Current regulatory guidance and consensus statements recommend precautions, including maintaining a separation distance of approximately 15 centimeters, avoiding storage of active phones in chest pockets overlying the generator, and exercising caution with magnetic devices, such as smartwatches and induction hobs. Reassurance extends to newer technologies, as leadless pacemakers and contemporary home monitoring systems are designed to coexist safely with modern smartphones, with no evidence of clinically meaningful interference during routine use. So in summary, yes, smartphones do have the potential to interfere with pacemakers and ICDs, mainly due to embedded magnets. However, current evidence indicates that modern smartphones pose negligible risk when simple spatial precautions are observed, and should not meaningfully alter everyday behavior or device management.